Ortho, ortho. Guys, we got another one. Getting into ortho can be a challenge, but we've got some tips and some strategies to share with a new ortho resident that just matched. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, and then life as a new dentist. Guys, be sure that you're sharing and liking the information. Where is it at? Yeah, right up here. Share and like and comment for others so they can also learn like you're learning and getting these tips. Also, today's episode is being brought to you by Dr. Darwin On Demand, but actually it's really being brought to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com, a resource to help you match into your ideal residency this cycle. Go down to the website and find out some more details as well. So today we've got another success story, another dentist who has matched into ortho. Today we're joined with student Dr. Alicia Briscoe, who's going to be sharing a couple things. Why ortho? She's going to talk a little bit about her process. She's going to talk about her interviews, her rank list, and she's going to share some tips and some advice. So be sure to stay all the way through. Okay? So, student Dr. Alicia, hello again. Hi. Congratulations. How you doing?
I'm doing good. Thank you so much for having me.
You're welcome. Thank you so much for sharing your journey to ortho. I know you and I have been talking since you were second year. Second year?
Yeah, I think so.
I can't believe the time has flown by. But now second year leads to fourth year. It now leads to becoming an orthodontist. So before we get started, I want to have you introduce yourself. Tell us a little bit about yourself for those that are meeting for the first time.
Okay. Hi, everyone. I'm Alicia Briscoe. I am born and raised in Bowie, Maryland. I'm actually going to be a three-timer Maryland success story. I went to College Park, University of Maryland, University of Maryland School of Dentistry, and I will be attending at the University of Maryland School of Dentistry orthodontic program. So I feel like I'm the success face story of what Maryland can offer and things like that. So that's me.
Three-time terp. Three-time terp. We love it. So let's dive in. Let's brush it up. First thing, and everyone's why is different, but why ortho for you? Why did you decide to make ortho your specialty within the profession?
So my journey to orthodontics has been quite extensive. I went through a series of different career path ideas. One of them being a storm chaser, which my mom was like, that is not a thing for you. So that's a funny story that I kept telling different interviewers, and they were kind of shocked by that. But wanted to do storm chasing. I wanted to be an ER doctor, which I quickly realized that's not my jam. And then, I was really open-minded to dentistry because actually my mom is an orthodontist, but she never pushed me to do orthodontics. She knew that I wanted to figure it out on my own. So I kind of went into my first year being very open-minded, but I quickly realized that orthodontics is what I wanted to do. And so orthodontics, what I really, really love about orthodontics is that it's a holistic improvement in the quality of life of a person. It's not just, okay, a pretty smile. Yes, that's part of it, but people don't really think about what a nice smile, meaning a nice straight aligned smile means. Not only is it aesthetic, but also it helps you clean your teeth better because you're able to get in between the teeth, decreases your caries risk. Also, we can expand the palate, forward movement of the mandible in order to help with breathing, things like that. Also, your mental and emotional health. If you're not confident with your smile, chances are you're not going to exude confidence in that interview or that date or whatever it is. And when, you feel confident about your smile, you're going to feel, just better about yourself overall. And so I really like that you get a whole improvement in quality of life through orthodontics. And whenever you think of, when you smile and someone's like, oh, your smile's so pretty, you think of, oh, Dr. So-and-so. It's not just like this doctor here, this doctor did this filling, whatever. It's like this doctor did my braces and this is the product of what they did. And so I wanted to leave as many little impacts on as many people as possible. So that's why I chose orthodontics.
Sounds good. Great why, right? Because you're right. One of the first things people see is your smile or lack thereof, right? Yeah. Or those teeth that are like rotated, turned, missing, dark, discolored, and that's not a good look for job interviews or for social engagements as well, right? Mm-hmm. So let's talk about the application and how you prepared, because it's a process. It's not just everything your D3 and D4 year as far as getting your application together. For many future residents in ortho, it starts much earlier, right? So share a little bit about the journey and the process as it relates to your application as well.
So like I said, I figured out that I wanted to do ortho really early on. And so I made sure to introduce myself to the orthodontic program director very early on in my first year, so that he kind of knew this is my face, I'm very interested, kind of give me guidance in terms of what I need to be doing over the next few years. So I would say definitely D1 year, if you even have an inkling that you want to do a specialization, whether it's orthodontics or any of the other specialties, I say definitely really focus your very first year on doing as well as you can in your courses. If an opportunity for research is available, I don't know if I would recommend that because D1 course load is so heavy. So I think I would really say focus on your grades and leadership positions your first year. Second year, that's when you can start doing research and continuing doing good in your courses, and then also exploring the research aspect. And so research, some people really love it. Some people really don't. I'm on the side that I don't really love it, but I've done a lot of it. I did research in undergrad because I thought that dental school really wanted research. So I did 2 forms of research in undergrad. I did 2 resources of research in dental school as well. So all that kind of adds up, and they were all not necessarily dental related. So that made it kind of interesting to talk about. Third year, by the way, first and second year, you really want to start thinking about, okay, who from maybe my first year do I want to keep up with in terms of, faculty saying, okay, checking in every semester, like this is how I did this semester, what can I do next, and things like that. So I had a faculty member that wrote me a letter that I've been keeping up with since my very first semester of dental school. Third year is when
was this faculty member in ortho?
She wasn't, but she was someone that's really seen my growth over the period of time. And it wasn't just school related. Like I talked to her about a whole bunch of different things. And so she's seen me grow as a person through dental school and like just like outside things. But then for third year, that's when you really want to start, thinking about who in clinic do you want to write your letter, and do you also want to about what ortho faculty or orthodontist or whatever is going to write your letter.
So basically the maintaining the communications, just so people understand, that maintaining that communication with a faculty member, whether it's starting in the first or even second year, is for a purpose, right? Mm-hmm. And the purpose is what?
The purpose is you want them to write you a fantastic letter, not just, oh, I've seen them in clinic and they do good work. Like, no, they want to write you something that's very personal. And actually in one of my interviews, they were like, something about your letters is so different than other people's letters in the sense that they're very personal. And that's what's about.
There you go.
The faculty that wrote me my letters know me very well. So I think that's very, very important.
That's key. That's key because
very, very key.
Faculty who are reading the applications and reading the letters can directly relate to certain ways that the letter is being written on your behalf, right?
Right.
We can tell whether it's a template letter and we're just kind of fill in your name and your couple things here and there, or if it's a letter that is a little bit different because the faculty member and your connection is a little bit different, right? That can come out in the letter. So I just wanted people to understand a little bit more as to what you were saying about the reason for staying in communication with faculty members, but letting them know your progress and having conversations and building that relationship with a faculty member early on. Very key.
Very key.
Very key. Very key.
I would also say, which is really, really important, do the things that you like. Because of course on your CV, people are going to read, okay, this person did research, this person is on all these honor societies or whatever, but also they have, the miscellaneous like extracurricular things. So you want to also bring out what you like to do. Like if you're on like a knitting club, or like you played volleyball like me in dental school, like you want something that's going to add some flavor to your application, and that you're not just this like black and white, like plain applicant. You want to show the ways that you're different and that you can add something to their program and to the orthodontic community as a whole. Also, I would say in terms of the application itself, you really want to start writing your personal statement as soon as possible and have a ton of people read it. Not just, ortho faculty or dental faculty. You want to have a whole bunch of different people read it. And is it interesting? Is it, cliche? You don't want the faculty at the orthodontic residencies that you are applying to look at it and be like, okay, I've read this at least 20 times.
Right. I've heard this already.
Yeah, I've already heard this story already. Like, what makes them different? You really want to have a lot of people read it and ask them, was that interesting? Or did you like kind of fall out in the middle of it and then you came back in at the end? So that's super, super important as well. And just turning in your applications early is so crucial. And ask if your school does committee letters or something like that, you want to ask for it ASAP.
Yeah, because go ahead.
No, it takes some time for them to write it.
Yes, they're not just writing your letter, they're writing everyone else's letter, whether it's for ortho or for perio or for pedo or for a GP or AGD program. They're writing one for everybody, and it takes time.
Yeah.
Definitely takes time.
And just to get everything into the pass application, that takes time. So the sooner you let everybody know what you're doing, the sooner that they can bring everything, you have everything together so you can send it out.
For you, what was that time period? Probably was third year, around what month between third and fourth year, that time period?
I was definitely writing heavily on my personal statement in like the spring semester. It was pretty hectic because obviously COVID was an issue.
Yeah.
But I would say definitely like maybe the latter half of the spring semester is when I was really cracking down on what my personal statement was going to say. But I also had told the faculty that I was interested in, who I wanted them to write my letter. I told them early on in spring semester, to the point where they were like, okay, like we're not writing letters yet, but we have you on the radar. And I was like, okay, as long as you have me on the radar.
That's right. Put my name on the list.
Put it on the list early. So I think just doing everything early so that it flows better. Because I know a lot of applications or a lot of schools, some of them had really early deadlines.
Yes.
And even like way like before their deadline, they were starting to interview people.
Oh yeah. Oh, absolutely. So, that's another reason why you have to have your applications in early, because not only is ortho, especially those programs that are match programs, because many of them are, not only is ortho one of the programs that's phase one of match, meaning your rank list and everything has to be done and interviews have to be completed in November. And then 2 weeks later, early December, if not late November, is the match list. So you do a reverse engineering and go back and you'll see why your dates and your application process must start early.
Exactly.
Must start early. Let's talk a little bit about the schools that you applied to and how you the number of schools and why that number versus, maybe other decisions that you made as far as the schools. So let's talk a
Right.
little bit about that.
Okay. So I applied to 26 schools. That's on the mark where people tend to apply. Some people do a little bit more, some people do a little bit less, but I definitely feel like a lot of people do in the 20s, at least the ones that I was speaking with, the other applicants. I did 26 because the match process is just like, I mean, there's a method to it, but it's not like cut and dry. It's not like, oh, if you get this many, if you apply to this many, then you'll get this many interviews. There's not a guarantee for that. So I'd rather have aimed high on the higher end than not, and then kind of losing because I didn't, I like those schools didn't extend an interview for me. So I wanted to kind of apply broadly, and the ways that I kind of determined what schools I was applying to was based on location. Location for sure. I was reading on their websites kind of the things that they were doing, what kind of research in some ways, what kind of technology did they have, how many residents did they have, because Maryland's a pretty big school, and I know what it's like to kind of try and get chairs and book appointments and things like that. I definitely wanted a smaller program where I'd get my own chair and I wouldn't have to, fight with my co-residents to get appointment slots. I also kind of looked at the diversity aspect of it. I didn't really expect too much because it's such a small cohort. I wasn't expecting, every school to have, all these people of color. I kind of knew that wasn't going to be the case, which is fine. But I also wanted to see what the faculty looked like. Were they all, trained at one place, or were they trained in multiple places and then they just came to whatever program it is? Because I think that's also really important. And that was a kind of a topic I learned about when I had one of my interviews, where they were saying, oh, our faculty are trained at all these places. So that was on my radar during interview season for the interviews I had. That was something I made sure I asked was, are all the faculty trained here, or are they trained other places and they're bringing all their unique, experiences to this location?
Right. Right.
So I would definitely kind of do research on the faculty and other schools that you're interested in, for sure.
Yeah, that's definitely important.
Yeah, but definitely location and technology, and later on faculty was the three things I was really looking at.
So let's talk about interviews. 26 programs. Before you can get into programs, you have to have interviews, which is the next step. That's why you're working so hard to put your application together. That's why you're working so hard to get your letters of recommendation, so that you can get to the next step, which is interviews. So let's talk about the interviews. Anything unusual about any interview days or interview questions, so people can learn a little bit about that as well.
Yeah. So I applied to 26 schools. I got 6 interviews. All the interviews, I feel like for the most part, were very relaxed, which is something that I really appreciated, because I don't feel like you need to be grilled at something like this. And just to kind of give you guys a ballpark of how many people how many people apply and then how many people they interview. It seems like a common trend that schools were getting over, especially post-COVID. Well, I guess we're still in it, but post-COVID, they had like 300, 400 plus applicants per program. And then they picked at least 30, at least max 35. So to get an interview, that should be something that you're very proud of, because that's a tiny percentage of 400, 300 people that applied.
That's just in itself, that's about, 10% of those that apply.
Yeah.
Get interviews.
Yeah.
And then we're going to the next, right. And now we're going to the next stratification level.
Yeah.
Right.
Yes. And so the interviews were pretty relaxed for the most part. They really do want to know, like, who are you? Because obviously you have the marks to get in, which I will say something about that later. You have the trends that they like, and they also like maybe your story or the things that you're interested in. So they want to, learn a little bit more about you. Yes, they ask the why ortho question. That's, a given. So make sure you know how to answer that. They also asked me a lot about like, oh, what do I like to do for fun? Which is where you can, make sure you're kind of interesting as a person so that you can add something and, shock them. I always did the storm chaser thing because people were like, where does that come from? So that was like a cool thing that I used to kind of speak out about at the interviews. Some odd questions that I had, well, they sometimes give you philosophical questions. And that kind of like threw me because there's no right answer that they're looking for. It's just like, okay, what is your thought process? How do you react to being kind of like not startled, but like thrown off? And then just like how you support your answer to that philosophical question.
What was one of those questions? You remember?
Yeah. One of them. So I had one that was just like philosophical, like straight up philosophical. The other one was more ortho related. One of them was, if you're a judge, and which one do you feel worse about, letting a guilty man free or innocent man going to jail? Yeah. So that was kind of tough. Had to take a second. You can always take a second to think about your response. Like, you don't have to think like right there. I said, I think innocent man to jail or something like that. Then they asked me about more of an ortho related philosophical question, which I don't know if it's philosophical, it's just like an ortho question. They said like, okay, a patient comes in and the orthodontist previously missed a impacted canine. And the patient learned about it. They're very upset. What do you do? And I was like, ooh, I was like, I'm not an orthodontist yet. But I said something along the lines of like, you never want to bash the orthodontist. Like, you never want to sit there and say, oh, this, how dare they? Like, no, that's not what you want to say. And also, I don't think it's, the right choice for you to, take a slash on your prices and say, okay, let me fix them. Like, let me cut, like pay or charge you half or something of my treatment price when it's not my fault.
Yeah.
And
still has to be done. Still gotta bring the done. Yeah, you still gotta move, you gotta bring the canine into the arch.
Yeah. And obviously let them speak and express their whatever and be understanding and whatever. And I also said that I would like to call after the fact, call the orthodontist and say, okay, your patient came. Don't reprimand them. Like, don't be like, how dare you? Like, be like, I just want you to be aware that this happened, just in case, I want this to be on your radar for future patients. Check for an impacted canine. Like, don't reprimand them and be like, how dare you? I'm gonna report you. Like, no. And I checked this with my mom because my mom's an orthodontist and she said that was spot on. So I was like, yes, good.
Spot on. Yeah. Yeah. And at the end of the day, it's also, sometimes you kind of want those situations. Not that, you want other people to miss stuff, but you want the opportunity to have the ability to learn from not only things that go wrong for you, but for other people too, right? It's a learning lesson. That's something that you can now take in your toolkit and be like, impactions.
Yeah.
impactions. Do I have a Ceph? Do I have what do you call it? Oh God, I can't even think of it right now.
You're gonna say like CBCT. Do you have all these?
Yeah, let me check my CBCT. Did I check it? So
yeah.
It's a learning lesson, right? As well.
Yeah. And then I would say also for people who have orthodontists in their family, be prepared for the question about, like, I feel like at every single interview when they knew that my mom was an orthodontist, they were like, so where are you going to practice? And I was like, oh, like, I don't know that far. And which is the truth. I don't know.
Yeah.
But from what I've heard is that they want to see if you're going to be a competition to that dental school or a competition to their own practice. If you decide to say, I want to stay there, which is kind of crazy. Like, I don't know how I feel about it. Cause like, obviously I'm not in the situation, but that's what I've been told. I've been told that that's the reason why they asked that. Cause are you going to serve as a competition?
And I will tell you, that's crazy because there is no competition. People make decisions as to where they want to go based on who they meet at the office, not based on, not based on there's so many, I don't know who to choose. I'll just pick somebody. It's dependent on who they pick and how the people in the office, in the orthodontic office, treat them. That's one of the factors, right? So
Yeah.
that's a whole nother discussion.
Yeah. Well, lucky for me, I don't know where I want to be, so I kept saying that, and they were like, "Okay." So.
Yeah. And which is true. You don't know things. You know, you don't know right now where you're going to be in 3 years. You don't know.
Mm-hmm.
A lot of things happen.
Exactly.
Got a lot of places to explore, right?
Exactly.
So one of the next things we want to explore is you had your interviews. Now you have to come up with ranking those 6 programs. So share with us like how you went through a little bit about that process, how you went through that process as far as you've had your 6 interviews. I'm sure that your list when you started changed, you know, those 26 schools, now you've got 6 schools. And before the interviews, you had them probably had them in order, right? Then after your interviews, now that order may be discombobulated and stuff. So let's talk a little bit about what you did after your interviews to kind of help you with your ranking.
So after each interview day, I would come back to the hotel because some of the interviews were in person, some were actually virtual. I would kind of like write down the things that I liked, the things that they offer. Eventually tuition, that was important as well, and also cost of living to live around that area. Actually, so I had 6 interviews, but I actually only ranked 5 of them. So I was kind of thinking about location. Mainly location was the, you know, where everything was kind of on the same playing field. Like I had places from all over the country. And so I was like, okay, where would I like to live? And one that I thought I was really going to rank them super high, I was like, actually, after the interview, like we're going to take it down.
So was it because what you heard and what the vibe was in the interview was different? And that made it, you know, maybe go down or change its order?
Yeah, it was like the vibe of the interview. It was kind of the vibe from the residents. It was also I don't see a purpose of, you know, you being an orthodontist or orthodontic resident and staying till 10 p.m. at night in school. Like, what are you doing?
Right.
Like, what are you doing? That's dental school issues.
Right.
Like, what
are you waxing the whole art and then putting brackets on it? Like, what are you doing?
Yeah. And so I was like, no, I been there, done that. Don't need to do it again. I think there's importance in being able to make an appliance. Like you should definitely 100% make your own for sure. So you know how to fix it. So if you get if the lab sends you back something, you're like, that's not exactly right, you can fix it. But I don't think you should make all your appliances because like it only changes but so much, and that's like a lot of additional work. And so that was the big thing that I was like, I don't want to stay at school till 10 making appliances and being stressed out. This resident seemed stressed out, whether they were trying to hide it well or not, they seemed stressed out. And I was like, no. So I ranked them. They actually went from like 2 to 4. Like I was like, it was bad.
Yeah. Bye-bye. Bye-bye.
I was like, wow, I was not expecting that. Then the other schools, I was thinking about, you know, how the program actually was and how the residents were. Are the residents happy? And so then I started ranking it based off that. And I was like, okay, this program has, you know, all these high technology things like that. They seem happy. They don't seem stressed out like 100%. Like obviously the stress is different, but it should not be equivalent to like dental school stress, I feel.
No,
but
that's too much.
That's too much. I don't need that.
Too much. With your resident, where would you say, as part of this question, where would you say the importance of that resident feedback and the ability to talk to those residents? Where would you say is how that ranks as an important factor to help you rank the programs?
It's important. Like if residents are saying they're not happy, like residents should tell you the truth. And I mean, I'm always like for dental school, I'm always telling, you know, future applicants, these are things I like, these are things I don't like. No program is perfect, but you're trying to figure out what it is that they don't like. And is that a non-negotiable for you?
It's important.
And I always say that to dental students, and they were saying that to me as well. So, you know, patience or them not having enough patience is different than like them not having patient lights, like that as their issue. Like I'd rather have no patient lights and just have to wear a loop than, you know, not have enough patience and like have to go out and find patients.
Right.
And so that was something that was also how I kind of further split them, was what their issue was, or what their complaint was.
I know for some candidates, the importance of the preparation for boards, right? Yeah. So that, you know, the pathway to becoming a board certified orthodontist is important. And some schools will consider or rank it as, you know, one of their strengths. Was that a factor for you as well, or not as much?
I guess I thought about it kind of subconsciously, in the sense that like, okay, if you have a lot of patients with like a diverse population pool, chances are you'll have like enough knowledge to do well on the board exam, versus like not. If you don't have enough patients, you won't see enough things, you won't be able to treatment plan and things like that. So I guess I thought about it subconsciously, but not so much like what's your pass rate, like that kind of thing. I didn't really think about it like that.
Gotcha. Okay. So that's good. So that's good. So you put your new rank order list together. And as you have shared, it was successful because you matched.
Yeah.
Yay, you matched. She matched. And we'll be going upstairs.
Upstairs, literally.
To the upper room called Ortho Residency at the University of Maryland. So that's great. Congratulations. That's awesome.
Thank you.
Awesome. A lot of folks are jealous right now. They wish to be in your position this coming up year. And there are some that are looking to be in your position this time next year when they apply, which leads us to our next question, which is advice and tips for those that are considering applying to ortho, knowing what you know now, and give us, 3 or 4 tips or pieces of advice that you would share with those applicants.
Yeah. So I would say my number one tip is never count yourself out. In the sense that you may say, okay, I look at the stats and everybody always, they're saying, oh, they only accept their number 1s and 2s at your class and you aren't like all the way up there, or your grades aren't like stellar or whatever, or you don't do all these things. Like, don't count yourself out. There's a lot of times where, stats are important. Yes, like look at trends, but there's a lot of times where you actually don't fall into that stat and you also make it. And the only way that you will know that you 100% will make it is that they tell you you did not make it. There has been, I have a few friends that, they, and even myself, like we didn't 100% fit that stat. Like we aren't number 1 in my class. We aren't, published like people and things like that in research. But, we took the chance, and, people who had 10 interviews did not match, versus also some people who had only 2, they did match, or 1. And so don't count yourself out before they count you out. And even when they count you out, like try again. Like, don't think, oh, I didn't make it, that's the end of my journey, I have to figure something else out. No, the pool of applicants every year changes. So maybe in this pool, people were like killing the game and they took COVID and they did all these things and you kind of got overshadowed. But maybe the next pool, you may like really stand out. And I just feel like just trust in yourself, say, I'm a good applicant. And it just, even if you aren't hitting those marks in terms of grades or GRE, which is like, take the GRE, if you want to do well in GRE, take it like early. I didn't do too hot. But like, and if schools like are super pressed about GRE and they won't look at you because of that, then like, it's fine.
Yeah. There's some studies that have shown that the GRE is not necessarily a very valid indicator as to how you're going to do, but that's a whole nother discussion as well. But take the GRE if you have a program that you're applying to and it's mandatory. Take it early, get it out of the way
and do like decent. Like you don't have to kill it, but you just do decent. So don't count yourself out. Always try. If it's your passion, keep going. If you didn't match, like don't think, oh, I'm never gonna make it, or I'm this, that, and the third in a negative sense. Like just say, you know what? We're gonna try again. I'm gonna try and do some other things, get different letters, apply different schools or whatever, and try again. There was also one other thing I wanted to say about that I'm trying to think of. Also, another important thing about, just taking a bet on yourself is, a school may bet on you and say, you know what, she doesn't have these marks, but something about her story is interesting. And you may get that interview, blow it away, and then there you go. So
it only takes one. Only takes one yes.
Yeah.
Only takes one yes.
Bet on yourself.
Yeah.
Don't compare. Also, don't compare, please.
Yeah, don't compare. That's good.
That's like for pre-dentals, whatever, dental students, like never compare, because that's going to be the thief of joy. And like, you're going to feel bad about yourself and all these things. And people are going to say, oh, she's not going to match. Like, come on, her GPA is so low. Watch out.
Watch out.
Don't do that.
That's right. Like, don't sign up for that class.
Don't do that. Don't be the person that's saying that, and don't like let people tell you that.
Yeah.
Because God doesn't like ugly. If you believe in that, the universe don't like ugly.
That's right. It'll come back and hit you the wrong way. So don't compare. Don't compare. But also make sure that you do prepare. Preparation is very key, because whether it's an in-person interview or virtual interview, that is your last, first face-to-face and last opportunity to tell everybody why you. Yeah. Why you as a candidate, and why you as a future board certified orthodontist. So prepare. And again, quick little plug, get into dentalresidency.com is an option and a tool for you to help you prepare for those interviews. Because it's key, right? That's high stakes. When you get that interview, that means you're this close. You're literally this close to knocking on the door and being let into the door. So you got to crush that interview as well. Just like Dr. Alicia just did. She crushed the interview, both at her ortho interviews, but also with us today, and sharing how she matched into ortho. So again, thank you so much for your time. Guys, check out these next set of videos right here. Hopefully these are helpful to you guys as well. And that's our time for today. Love, peace, and smiles. We'll see you.
Bye.